Hi, welcome to this episode of Dr. T Spills the Tea. I am so excited to share on the topic of psoriasis, something that I see absolutely every day of my life as a medical dermatologist. I love psoriasis as a condition that we can make a big impact on. Now, what makes this very topical is a very brave and an incredibly heartfelt article that was shared and written by Kim Kardashian. So I just want to refer to this article because it is such a good guide to psoriasis. One of the important points that was brought up is psoriasis is indeed something that involves the immune system. Now, a lot of the things that we are learning about psoriasis has shifted our views as dermatologists, and that's because the research is coming in fast and heavy, and there are so many new therapeutics available. Now, as an autoimmune condition, Kim goes on to say that it is something that also affected her mom.
Does that look familiar?
Kim, psoriasis. I obviously didn't give you this condition on purpose.
That's an important point to share as well, because many times families can be affected. And in fact, there was even some more sharing about the role that sometimes sunlight can play in helping some people's psoriasis. Now, unfortunately for Kim, that didn't make the biggest impact, and she was fortunate enough to actually come into contact with a dermatologist who she knew when she was younger. And what was key is psoriasis can sneak up on you in adulthood. You know, you'd consider that many conditions, you're like, why don't I have it as a child? Why did it hit me now? And psoriasis is classic for that. In fact, it sort of shows up as two peaks, late 20s, early 30s, and again in the 50s, where that's where people are most likely to suddenly develop it. And often it is no fault of their own. Certain things can cause psoriasis, like trauma, infections, certain medications, smoking, and some stressors can also set off psoriasis, but many times we just have no other clues for why it happens other than maybe a little bit of a family history. Now, interestingly, there was a treatment brought up called steroid or Kenalog injections. Now, I love this because many times physicians and dermatologists may forget this as a really useful alternative to long-term use of steroid creams or other pills that patients may not like to be on. I love it if and when a steroid injection can clean things up, which it did in Kim's case for 5 years. Those steroid injections can be really handy and very safe to make patients much better for a long time. Now, what was even more interesting was the really great scientific view she brought up in her article. And that scientific view brought up the point of pregnancy, where some women will actually find their psoriasis clears up in pregnancy. Now, that makes sense, and I'll explain to you why. Remember, in pregnancy, the first role of the mother and the body is to make sure that there is no rejection of the baby that's growing, which means that the immune system is kind of curtailed. So a lot of things that are highly autoimmune are suddenly relaxed in pregnancy, which is why her psoriasis got better. Now, in her storytelling, she also shares that things got worse after pregnancy, which is also not an uncommon scenario. Lastly, she brings up the point and the role that there are some systemic involvement of psoriasis. And again, I really want to thank Kim for making this really important exploration about how it's not just a disease of the skin, which in itself can be very debilitating to the patient. It's something that can affect their self-esteem and their sense of well-being. But it's a condition that can even affect other organ systems. So in fact, there's associations with psoriasis with cardiovascular disease. It can affect mood as well. It can affect interpersonal relationships. It can affect the eyes, in fact. And lastly, we also know that the joints can be heavily involved in psoriasis. Now, psoriatic arthritis is that condition. Now, with psoriasis, we know that the involvement of the joints is very specific to involve certain joint systems. And in the case of her article, she kindly and bravely shared that the joint system that really affected her was her hands, and how even holding a cell phone was very painful.
It was really hard because I couldn't pick up the kids for a while because I had a lot of pain in my hands. So until I figured it out of what was really going on, I really needed to just like take a break from lifting the baby, and that was really hard for me.
I hear this day in and day out, and it's something that we do not pay enough attention to. So there you have it. That's Dr. T Spills the Tea. Just wanted to share that. Again, it's my passion, medical dermatology and psoriasis. We are lucky enough to do clinical trials here, and we're always looking for a way to help the next generation of patients who are going through things, adding to science, educating patients, and of course, recognizing great work when it's done. So thank you, Kim Kardashian. Take care, guys. We'll see you next time.